Good morning, everyone. It's quite a few people that are going to be coming to this discussion today. So first of all, thank you very much for coming today, and thank you for joining us in the discussion. My name is Jana Bitten. I'm the Executive Director for the Oregon Center for Nursing, and today we are going to talk about simulation education and do a Q&A discussion with Oregon experts. And if you were thinking that you were going to get on the call and you were going to have a whole panel of people that were all experts in simulation that were going to tell you everything that you're going to need to know, the answer to that question is there is no one. And that is why we're having the discussion. You all are the experts. There are some people that are on this call that have a lot of experience in simulation. There's a lot of people on this call who just tried to start figuring out how to do especially virtual and screen-based simulation a couple of months ago. So this discussion that we have today is we will really want to talk about, have this be an incredibly interactive session. So if you would like to have your camera on, all the better. If you would like to keep your camera off because you're tired of the Hollywood squares and you didn't do your hair this morning, we don't care. We are so glad that you are here today because it's the discussion that we're going to be having together that's going to be able to answer the questions and really lead us forward as we try to identify some of the best practices about simulation. So I'm going to go ahead and get started with the slideshow. So I wanted to just start out and kind of like lay some foundation so that you know where we are. Originally, I titled the slide, "What do we know?" And then I added today, because if you are experiencing this in the same way that we are, just because what we know today about nursing education and simulation is not what's going to be true tomorrow. So let's just work on what we know today so that we can kind of start to adapt and understand how we can really help each other. So first of all, now also another caveat that I want to put out there is that originally when we put this together, this whole discussion came out of an activity that the Oregon Center for Nursing holds every Friday. So every Friday at 8 a.m. we hold what we call a Friday huddle. And it's basically, if you are interested in nursing and nursing workforce issues, we have a belief that as a community, nursing can really, really help influence the outcomes of this public health crisis of both COVID, the systemic racism, and COVID again, and then whatever is going to be happening between now and the end of the year. I know that nursing can really make a difference here, but we can only do it if we're working together. So one of the things that we've been doing as part of the Friday huddles is we've been talking a lot about nursing education. We've been talking a lot about simulation, and out of that, I'm actually starting down at the bottom where it says OCM Simulation Study Task Force. Out of that, we've identified some people that have really been working with simulation, nursing education simulation in a lot of different ways, who have a lot of experience in it. And we've been trying to get our hands around what is it that we know about simulation in the state? What do we know about how people are using, especially the virtual and screen-based simulation, once everything has moved into an online curriculum. One of the things that we did was we checked with the Board of Nursing, and again, I will warn you, we did this really looking at registered nursing programs. Now, earlier this week, I was talking to Deb Buck over at the Board of Nursing, and we were talking about how CNA programs are using simulation as well, and it seemed like a lot of the theory around simulation education applies whether you're in a registered nursing program or whether you're in a CNA program. So thank you to all the CNA partners who have joined us today. I'm hoping that we can answer some of your questions. This is what I know is mostly based on what I know about registered nurses. In the plans that registered nurses submitted, or registered nursing programs submitted to the Board of Nursing, they were supposed to explain how they were planning to deliver education after the pandemic hit. Pretty much of all of the plans that came in, every single one of them did something different. Every single one of them implemented simulation. Every single one of them used a wide variety of different products to do the simulation. There was no consistency at all. that makes it really, really hard when you are just trying to figure this out on your own and you're having to use a product and use the resources that the product gives you if you haven't had that experience with simulation before. So there was no standardization. There was no way that we could kind of figure out like, and this is the product most people are using, and so let's do some training around that or get some professional development. That's not true. Everything is kind of out in the open. It's kind of a big, it's really, really scattered. We also know today that online didactic and simulation education has been approved to continue through the winter term of 2020. And there's a lot of programs, like almost every program in the state of Oregon right now is already planning on doing online instruction, especially for fall term, even into November. But I know that, well, for schools, Portland Public Schools is doing it until the middle of November, but I think for a lot of you, you're just fall term, that's just what you're doing. So if we know that we're going to be doing online simulation, if we know that there are a lot of products out there, if we know that everybody's using a little bit different things, the other thing that I know is that there are probably a whole lot of questions about what you should be doing. There might be some things that work really well for you and that have worked really well for you, and there might be some things that have not worked really well for you. Some of the things that our task force has been talking about when we look at those, when we looked at those different educational plans and we kind of talked about how nursing education is implementing this screen-based simulation, as we were talking about, there are a lot of questions about how do you prep for sim? How do you do the prep before you do the simulation? How do you do the debriefing? What are the best practices around debriefing after the simulation is done? What about the roles of the observer and the active participant? How does that all work? I'm certain that there are a lot of questions. Now, there are members of the Board of Nursing that are on this call. We can see Deb right over there in one of our squares. Hi, Deb. Now, there are people here from the Board of Nursing, but this is not a call about regulation. This is a call about practicality. Like, go ahead, there is no question that is off the table here. And this is the opportunity for you to ask, you know, if you had an experience with some simulation that you did in spring, you're not quite sure if this really worked out, or if there was a better way to do it, describe the situation and ask the question, because here are the Oregon experts. This is the opportunity for us to get together and try to fill the gaps for each other. So with that, I'm going to give you some ground rules about how to participate so that we can get everybody here to participate. So first of all, you are probably all adept at using Zoom. If you are not, you have two ways that you can do this. One, you can go down to your chat box. There's a chat button at the bottom of the screen. You can get into the chat box. Go ahead and get into the chat box right now and just go nuts. Put in a little note about yourself or just ask a question, or if you just want to say hello to everybody, that is totally fine. That's where you can put in your question or your response. Another opportunity is you can also go into the participant tab where you have a way that you can raise your hand. If you raise your hand, the two people from the Oregon Center for Nursing that are here with us today is Kelly Illich. She's our producer today, and she can unmute your line and help facilitate the discussion. We also have Research Director Rick Allgeier, who is here, who can answer some questions about the literature that he's been reviewing and some of the best practices that he's been finding. A couple of other people that I want to recognize today. Nick Meal from OHSU is part of our OHSU Simulation Study Task Force, who is here, who has, it looks like OHSU has done a lot of evaluation of the screen-based and virtual simulation for their faculty. So he can kind of give you some feedback about what his experience is there. Julie Fitzwater is here from Linfield. She's also on our task force, and she's had a lot of really, really good feedback about simulation, how they've used it at Linfield. And then Paula Tomczak is from Lane Community College, who is also on our committee, and she has lots of questions. So She kept saying last week, I'm not an expert, I'm not an expert. I'm like, she's more of an expert than me on this because she's done it before. So go ahead and raise your hand, put a note in the chat, be ready to respond. Introduce yourself. Let's get to know each other because we're all going to work together to try to help each other in this situation. And then if you have anything you've been working on that you think might be helpful for this particular group, go ahead and email it to this address, this email address below. So there's another person who's on the call that I just saw her name, which is Michelle Collazo, who I have heard her name a million times. I have not had the opportunity to meet yet. She just got switched out and is on our task force, but this is her first meeting. So thank you for just jumping in the deep end, Michelle. So with that, I want to go ahead and open it up. Now, keep in mind, there are CNA instructors here and there are registered nurse instructors here. So I think that I kind of want to start out with, actually, I think if I could do this, Nick, let's start with you, Nick, if that's okay, if I can call on you. Nick, can you just share with us from OHSU, what are some of the big questions that faculty have asked, or what are the discussions about from the faculty about implementing screen-based simulation in the time of COVID?
That's a great question. For us, it was mostly, a lot of it was around faculty development, knowing that we had essentially really 2 weeks over spring break as we finished one term, had spring break, and then entered the next term, swapping from what we had anticipated as a clinical term as usual to all virtual simulation. And the development was really around how and when and where and why we were using virtual simulation and how to really prepare our faculty to facilitate and debrief. So really coming up with best practices on debriefing, actually developed a debriefing guide to help our faculty. Again, just knowing that many of them may not have had a great deal of experience debriefing, but we know that that's such an important part of simulation. So I think a lot of our questions were around, honestly, faculty development and really working with our faculty in this great pivot from live to virtual simulation.
Great. Thank you. Anybody else? Anyone have a question? Did anybody have a situation where they did some in-person, or excuse me, some simulation that was specifically virtual or screen-based that either didn't go well, or after it was over, you really had some serious questions about whether that was the right thing to do? All right, since there's nobody saying anything, as you will find when you come to the Friday huddles, if you don't say anything, I've got questions. So one of the things that came up in some of the task force discussions that we were having was the role of the active participant and the observer. Does anybody have would anybody be willing to share kind of their experience of looking at their students and trying to figure out, like, when you're trying to go into a screen-based or virtual simulation kind of scenario, how do you identify the roles of the active participant and the observer, and how do you get them both engaged and involved? You will also find that if you don't raise your hand, I call on you. All right, nobody's saying anything. But oh yeah. So I like how you guys are like, there's a way that you can like push a button to raise your hand, and you guys are like, no. Okay, Paula, let's start with Michelle Collazo over at UP, and then we'll go to Paula Tomzak. So Michelle, go ahead and unmute your line. Let's start with you. Kelly, let's see. She's trying. Julie asked, where's the place to raise your hand? There should be a button for participant, and if you click on participant, then there should be somewhere that you can raise your hand. Michelle, I think you're open. Say something.
I think I am too.
Yes, it worked.
Yeah.
Okay, go for it.
Okay, so yes, forgive me. I was looking also for the button to raise my hand, but now I think I found it.
Yeah, there you go.
Okay, so Jana, your comments were about observers versus active participants, and we too, we made the switch in the spring for moving all of our students online, and it did go actually very well. We were able to convert our progressive simulations into telehealth visits, and it was a great success. But we were just very clear in our pre-brief about those roles of observers and participants, and so we kept our groups small. We were able to do that, and so it was very clear with the faculty delineating who was doing what and what the purpose was. That said, it was also very important for our facilitators, who are debriefers, to be able to bring everybody into the conversation during the debriefing following each scene. I do think it depends on the design of your simulation quite a bit. I think that there are a lot of variables in mind, but the first thing would be to explain very clearly up front to the students what it means to be an observer. And there's a lot of great research out there right now, emerging research about the observer roles and the effectiveness of learning through observation. So we were really leaning into that and engaging our observers purposefully. You could have a whole discussion about observation and certainly.
We probably will, but Michelle,
Yes.
You said something that I want some clarification. You said that we were doing it in small groups. When you say small groups, how small are you talking?
We had groups of 6 students, I would say 6 to 8. And so we had a variety of roles in our scenes. Again, they were telehealth visits, but we were working with seniors. So we were really trying to bring in some leadership components and transition to practice pieces into the stories. Okay. So we were just very, very clear about, okay, this is how it's going to work. You know, in scene 1, we have these 2 nurses are going to be our primary nurses, and we're going to designate another nurse as the kind of the clinic lead, the coordinator, and their responsibility is this. And I would go through and explain what I expected. And then, as soon as debriefing started, and we used the Pearls debriefing framework, we would come purposefully pull in our clinic leads and remind them what their role was and ask them to implement that. And it worked quite well, but everyone was very purposefully brought into the conversation. And part of what we talked a lot about was teamwork too. And so our debriefing questions would reflect those aspects as well. Yeah.
Thank you, Michelle. I really appreciate that feedback. Paula, you had your hand up. Paula Konzak. So go ahead, Paula. Can you get your line unmuted, or is it making us unmute you? Kelly is gonna, me? Got her point at me. Now, there you go. It worked. Give it a go.
Hi. Yeah, I was just gonna say, we were working with students in spring term of their very first year, ADN students. So they'd only been in the hospital setting for 1 term, and then all of this happened. And we were using iHuman. And so all students, so we had groups of 10, and all of our students went through the exact same scenario basically on their own, and then we debriefed at the end. And we had a lot of students who were extremely anxiety ridden from having to be on Zoom at all, and then having to talk too. So for those students who tended to be more observer-ish, even though technically everybody's sort of an active participant since they all did the actual scenario themselves, we would give them specific questions and say, come prepared to talk about this. So they didn't feel stressed out by being asked on the spur of the moment. And they did a much better job. And then other students who love talking, we didn't have to do that for them.
Yeah, great. Thank you very much. There's a couple of other people that had their hands raised, but I can't see those. Kelly, can you tell me who's got their hands raised? Okay, actually, I clicked a button and now I can tell. Looks like Jodi Bennett. Jodi Bennett has her hand raised. I'm going to unmute your line, Jodi. And Jodi, can you tell us where you're from too?
Yeah, just 1 minute.
Okay.
Trying to get my video up.
There you are.
Oh, I can't see me, but you guys can see me, so I don't even know if
And
I'm on
Jodi
the
is wearing a mask. Everyone, Jodi is wearing a mask.
Jodi just took off her mask for you guys because now I'm alone. I'm from Concord. I'm the simulation coordinator here, and I took over this about 7 weeks before we all had to close down for a week and go online. So I come from a long line of simulation experience in person, and then I came here, and then we had to go online. What I actually just wanted to address were a couple things from Michelle, for sure, because that's when I raised my hand. The first thing was just talking about groups. We actually used small groups of 4 to 5, and we were on teams, and our simulations focused on 3 areas. It was on a lot of history taking, just like in a telehealth. It was on education, because I was the only one available to be the patient in that. So I was a standardized patient / instructor, depending on which hat. And there were costumes, by the way. And then the third thing that we focused on was actual skills, where I had a myriad of supplies in front of me, and they had to tell me what to do with my hands. So surgical dressings, things like that, and neurovascular assessments and all that. So I really got to be creative. I was living in a 1,000 square foot space all by myself, and I had all my props and everything. So I kind of converted it to a studio. And the response from, and that happened over 2 terms. So the response from the students was positive. So I can tell you that it can be done. You can reduce a whole SP program down to 1 person.
Okay.
But the second thing I want to say was about the observer engagement that Michelle talked about. And one of the questions that I found that was the most effective for the students doing the observation role was asking them, what would you do in this situation? And they had to respond that way. So because we were using Teams, whenever we were having the actual scenario, everybody else went off video, so that the student in the scenario only saw me and I only saw them, which certainly helped with distraction, because we know Zoom is distracting and people go to the bathroom and all those kinds of things. And then when we did the debriefing, the other students came back on the screen, again, only 4 to 6 of us, including me, and they did address, what would I do in that scenario? What things, and they found in their feedback that that was the most effective thing, because it engaged them fully. They had to pay attention at every step to know what they would have done, whether they would have done the same as the student, whether they would have something differently. Is it different from the outside than from the inside? And we discussed that during our debrief.
That's great. Excellent. Thank you. Megan Colley also, and Jodi, yeah, hang on to you. We're going to come back to you, I'm sure, later.
Sure.
You know, when you become a one-woman show like you have become, I think that you probably have learned a lot that can share with a lot of people.
Absolutely.
So I'm going to put you on mute right now, but I'm not going to lose you completely. And we're going to unmute Megan Colley's line, because it looks like Megan has her hand up. So Megan, let's see if we can get you unmuted. There you go. Go for it, Megan.
So I'm Megan Colley. I'm at Oregon Coast Community College. We're teeny tiny, so we only, teeny little wee biscuit of a program out here. So we had the opportunity to actually bring some students into a simulation lab. We have a nice space there, so we had some people there, and then sort of alternate weeks, people working on online simulation, screen-based simulation, and then doing debriefings as a group and talking about how those things differed, how they were the same. That's sort of what we're doing. But I actually had a question,
Yes.
not a suggestion. So we have a lot of new clinical faculty who are really new into this role, less than a year. And I think we're hiring some new people now who don't have any experience. And this is a really, it's a hard time to mentor people into this role when we're also learning this role. So I'm wondering if any of you have, I mean, I know there's a ton of great research, but that can be really overwhelming as you're stepping in and learning something new. Does anybody have any simple tools, any simple scripts that we can provide to our clinical faculty so that they can have that to look at during debriefing, during like post-conference or pre-conference sort of settings?
Okay.
Sorry, that's a group question, and we can come
That is, I know that is a good, and Megan, that's exactly what this whole thing is about. It's
Yes.
exactly why we pulled everybody together. Michelle Collazo from UP stated, she put in the chat, I also recommend starting with the INAXL standards of best practice for novice simulation educators. You can start with specific standards, professional integrity, facilitation, and debriefing.
Love it.
So that might be one. Anybody else have any other suggestions? Can you raise your hand if you've got something you could share? Julie Fitzwater from Linfield said, University of Washington has some free modules about simulation and debriefing. They're a great resource. She's going to find the link and go post it in a moment. Nick also says that he has some pocket cards and he raised his hand. So Nick, I'm going to unmute you.
I actually have a couple of pocket cards that I developed for my graduate students that I teach in our debriefing course in the M&E program. One is actually based on debriefing with good judgment using advocacy inquiry that has just simple questions that you would use in the 3 phases. And the other one that was developed is on difficult debriefing, so some tactics to use if you come up with a challenging debriefing. Another good article too, we heard the Pearls framework mentioned earlier. The authors of the Pearls framework actually created a subsequent article that's a faculty development guide around debriefing and using that framework that could be helpful as well. So I'm happy to send those if that would be helpful.
Thanks. I had found, I guess I am getting really overwhelmed because I see all of these and I'm like, oh, this is a good idea. This is a good idea. And for me, that really works to read through a big mountain of stuff and then see. But I think as like our new baby clinical faculties, it would be nice to settle on something. And I have a colleague on my texting too here, like,
while you're doing
Bonnie, if you think something different, like something to just say, this is the thing.
Yeah.
So I'll look at these and see if we can come up with a consensus of like, this is the thing, don't worry about it too much, kind of just go with this framework. And as you develop into your role, we can add in other pieces.
Yeah, exactly. Thanks, Nick. Nick, can you send that over to this email address that's on the screen? And then would you be willing to share that with everybody?
Yeah, absolutely.
Okay. And people on the call, is that something that you feel like you're going to need? You can either, wave like this, or you can, yeah. Well, Deb nodded, so I think Deb probably has some people that she can think of. In the chat, Julie Fitzwater found the UW link, so you can go ahead and click there. We'll also keep that as the note for today. She put in some of the courses, Simulation 101, Intro to Clinical Sim, Sim 102, Pedagogical Approaches for Sim, for Critical Thinking, Sim 104, Briefing and Debriefing. Michelle Collazo said, agreed, UW models are fantastic. George Washington University has free MOOC. National League for Nursing has so many resources for simulation. Their ACE case series is excellent, but yes, you need a plan. It has to work for your program. Julie Butcher said, I can use anything anyone has. So we are here for you, Julie. We'll see if we can help you. Sandra Davis said that even Coursera has excellent and engaging set of weekly modules from George Washington University. I personally have taken an enormous amount of courses from Coursera, so I can attest to that. And Calvin Miller from OHSU said, great question, Megan. I always tell my colleagues just to be genuinely interested and inquisitive. In the end, we want to know why students do what they do and think the way they think. We can help with reframing and reaffirming their practice. I'm curious about the people, there's a lot of people here that are from CNA training programs. So for the people, and oh yeah, and Nick also put, there are great podcasts available. You gotta love the podcast. That's a really, really great way to get some information. For the people that are on CNA programs, it sounds like Jodi, learned on the fly. Do a lot of you also have to learn on the fly? And are you kind of to the place where you just don't even know the right questions to ask at this point? Or did you have an experience that you had some questions about that are related to debriefing or pre-briefing or anything else? You can raise your hand. You can wave me down. Okay. Debbie Iyer said that learning and absorbing resources. Julie Butcher says, yes, we are making this up as we go. We have to write all scripts and come up with scenarios. That breaks my heart. I don't want to help. I don't want you to have to like just make things up as you go, because I think that there's a lot of resources out there and we can help you identify those resources that are really going to help for you. Julie Winter said, we are still doing clinicals. Michelle Collazo is not a CNA program. She keeps waving at me. So we're going to go ahead. What? Now you're saying no? Forget it. I'm unmuting you. I'm unmuting you. Now you have to unmute yourself. There you go.
Well, you're right. I forgot you were talking about CNA programs. But, you know, I think there's always an element of needing to learn a little bit on the fly. I think for all of us, there is some of that. Yes, there are formal programs out there that you can train in. There are leadership programs. There are workshops. There are conferences, all sorts of stuff. But we're in this really strange time where everyone's jumping in to have to do this kind of work, and it is really challenging. And so one thing, because I saw some comments come up about people needing to write all their own scenarios and things like that. There is so much out there. You don't have to write your own right now, especially if you're just trying to get started. There are so many sources and resources out there. And I would think that even for CNA programs, you could modify and find scenarios that would work. I think.
So Michelle, can I interrupt you and ask you a quick question? What's your go-to for scenarios right now? Like, this can't be something that you just YouTube and there's something there. I mean, or it may be, but what is your go-to? Where do you go when you're looking for scenarios specifically?
Okay, so, well, I mean, I know I'm in a little bit different boat because I'm working with a team of people who we are actually writing many of our own scenarios, but we have been writing for a while. We were already doing this work prior to the pandemic, so that's just a caveat. Some of my colleagues in simulation have created, and I think it's been made available on the Society for Simulation in Healthcare website, a whole table full of resources. And of course, right at the moment, the names of all of them are not coming to mind. Montgomery College has some that are great. National League for Nursing, I would start there. They have so much work already in this, in simulation. They have wonderful stories with all sorts of teaching references. There are all sorts of materials that are already set up for you. You can follow their script to the T if you want, or you can adapt it based on your own program outcomes and your objectives. So that's where I would begin. And I can look up a couple of links while the conversation continues. And do you want links posted in the chat as well, or do you want those emailed?
If you post them in the chat, we'll capture them and then we can share them with everybody too. So either way, it's totally fine. Great.
But you know, Jana, it's hard to say like there's just one distinct method or one distinct place to go, because we all have a slightly different program, and that is part of the issue. There isn't a lot of standardization, right? And so
that's
kind of all over the place.
Exactly what we were finding.
All
right. Thank you, Michelle. There's some people that put some notes in the chat. They put in Cynthia Manning said learning and absorbing. Avkin, she put the link in the chat as well. That's good. Wearable sim technology and have regular webinars, so that's good. Nick Neal from OHSU talked about the California Simulation Alliance and the Ontario Canada Simulation Alliance as resources and cases available for free. I'm not sure if they still do. The Oregon Center for Nursing has been working with the California Simulation Alliance at some of their programs that they're doing, and I'll tell you about that after we're done here, of what we're hoping that we can bring some of that information together. Julie said, could someone put together a list of these resources for us? And that is Kelly. Wherever Kelly is, that is what Kelly's going to be doing. So as soon as we're done here, we're going to, as many resources as we can put together and give you kind of a list, we're going to put that together. We'll email that to all of you that are on the call today, or even the people who signed up and couldn't make it. We might actually even put something on our website so you guys have a place to go. And Sandra Davis said the SSIH or SSIH.org has many links for resources as well. Paula Tomczak from Lane Community College has her hand up. So Paula, can you unmute your line and go for it?
Yeah, so I was noticing, and I have been noticing over the past few weeks as we've been talking, that most people are not using a product. Is
Mm.
that true? Are most schools are using scenarios where where students interact with each other and run through a scenario that has been scripted? Does that sound right? Yes. So even something like that is good to know, because I think we thought that everybody was using these products and we were trying to find a really great product. But it
Yeah.
sounds like most people are not using products. And so even the knowledge that not using a product is the best way to go. That
Mm-hmm.
makes sense. So giving a suggestion to schools that don't go out and purchase a product, don't make your students purchase a product, use a lot of these free scenarios, and that is actually a better way of performing simulation with your students, because I think we
Mm-hmm.
were thinking the best newest thing was to try to use iHuman or vSim or one of these other products.
And it might be, but right now I think that there's a lot of people that are probably trying to jump on the simulation bandwagon because, they've got some experience in it and they know that there's going to be a really high demand for it, especially if people are going to be doing this online learning for however long we're going to be doing this online learning for. So I think you probably can get completely buried in the amount of products and the amount of information that's out there. What I'm hearing too is not only that, Paula, I'm also hearing that there are, that we might need to, maybe this group or some other, like we could start with our task force that we've been meeting with on a regular basis, but also we can share with this group or have get together on a regular basis, where we can kind of like filter out some of the noise and get to like what are the pros and cons of some of these different products. If you're not using a product, what are some best practices or some tips to make things better for you? And I think everybody has the ultimate goal, right? We want to make sure that our nurses, our registered nurses and our CNAs, that we're graduating the most educated, highly competent, just amazing people that we can possibly have, so we can just have everyone in the state of Oregon be safe and be taken care of when they're sick. So, if there's a way that we can start to filter that out, I think that would be really helpful. Lots of things in the chat. Jessica Sandstrom from Warner Pacific said that they're using Shadow Health. Bonnie Lassen is using ATI, and Bonnie asked a question. I'm going to come back to you, Bonnie, in just a second. Linda Campbell from Warner Pacific said they're also using Shadow Health, also Clear Triage, and Alpha Laerdal and Alpha Kaplan, but they also have a grant. And that's another thing, Linda, that I've noticed is that a lot of people, sometimes you'll use programs, but it's not just one program. It's like just Frankenstein mash of different kind of programs. So it sounds like you do have to kind of tailor it for you. Michelle said products have limitations. It depends on so many factors. And Nick over at OHSU said that they adopted vSim for the spring term. Moving forward, they're doing a more blended approach with screen-based telehealth and face-to-face simulation, which I think is great. Megan Colley over at Oregon Coast said that they're using Shadow Health and vSim and also scenarios and case study. And Paula reminded me that this is also true for LPN. Totally correct. Thank you for clarifying me on that, on catching that. Bonnie Lassen earlier up in the chat had a question. She said a faculty question. OSBN counts high fidelity sim as 2-to-1 for clinical hours for students. Is that translating to faculty workload? Does anybody have any thoughts on that? I'm guessing that the reason why Michelle Collazo is laughing is because she has something to say, but she feels like she said a lot already. Am I right? Yes. Okay, that's all right. Before we get there, Julie Fitzwater from Linfield said Linfield is using a blended approach as well now that we can meet in person for simulation depending on outcomes. They use face-to-face sim, telehealth or Zoom with an interactive avatar that is debriefed in a group on Shadow Health. They use EHR Tutor in the program, which has a patient chart library. So let's go back to the faculty question with the fidelity sim 2-to-1. Nick says that he thinks that it depends on the organizational structure. And Paula asked to repeat the question. Yes, so the question is, what are you seeing as far as your faculty workload go? How are you seeing, what's happening with your faculty now that the regulation is allowing, you can have, it's actually, you know what, Bonnie, I'm going to unmute your line. Where are you, Bonnie? There you go. Bonnie, you asked the question. I want to make sure that I'm doing this right. So Bonnie, what's the question?
Okay. So Oregon State Board of Nursing has said for clinical hours for students that high fidelity sim can be, and I believe even moderate fidelity can be counted as 2 to 1 for clinical hours. So if it's, so for direct patient care, it counts as 2 hours for every hour a student puts into sim. And because it is more intense, there is more, you know, it is, well, I guess, you know, basically with sim, as we all know, it is more intense, and there isn't any downtime for students when they're in simulation. So, so how does that, how are you translating that for faculty? I mean, that's something we've not addressed, and I'm thinking maybe we should, because it is more intense. It is, you know, you're not waiting for a student to look things up. You are right there with the group. And I'm just wondering, you know, kind of more from an administration point, I guess, how we should be reimbursing faculty and how schools are looking at that.
So Nick put in the chat that there was something about an article about faculty workload and simulation that he was going to share. Nick, do you mind commenting on that a little bit? Go for it.
Yeah, I can absolutely send that forward. It came out about, I want to say 2 years ago, but I think, you know, to some degree it does depend on organizational structure. Like the campus I've been on, the Monmouth campus at OHSU, our faculties, their workload, our clinical faculty, because they're in simulation, it really equates with the student simulation hours. So if the students got 2 hours credit for simulation, our faculty would have 2 hours of clinical. If the students got 4, if that was double, our faculty would get the same, because how they calculate their clinical hours. But my role is the simulation coordinator. I'm there and helping run simulations. It's just a function of my workload. So if the students did, you know, 8 hours of simulation, that's 8 hours of my time. It really doesn't equate in the same fashion that clinical faculty, their workload does. So I think it depends on how you're structuring and how you're staffing simulation to some degree, and what that workload looks like. But I completely agree. You know, for clinical, it's our faculty and students show up. There's generally minimal preparation as compared to simulation, where there's much more development going on the faculty side. There's much more development with debriefing and so forth. And for our students, they're preparing, and it's really this condensed, distilled educational experience.
Okay, thank you.
Thank you, Nick. I always love it when I'm speaking and I mute myself, and then it comes up and says, "You're muted. Why are you talking?" So thanks for that. Deb Buck from OSBN said, for clarification, it's 1 hour for 1 hour in the nursing assistant education programs. So for those nursing assistant education programs that are on the call today, are you seeing challenges with your faculty and with workload now that you're doing more simulation? All right, you guys are a quiet bunch. Okay. Kiki Fornero. Kiki, can you go ahead? You're unmuted. Go for it.
Sure. I just wanted to offer too something else that Linfield is doing is we have recorded some scenarios for fall with our student workers. So they assume the role of nurse and they worked with an SP, and we did 2 videos. So the students will participate on Zoom. They'll be pre-briefed. They'll view one less than optimal interaction with the patient, and then they'll debrief about it, and then they'll view another interaction that's closer to optimal, but not perfect, because none of us are perfect, and then they'll debrief about that as well.
Okay, great, thank you. You know, I might want to change subjects. I noticed that we've only got about 15 more minutes left in the call, and I want to check and And it seems like we might need to get a little bit more information for you, Bonnie, because that article, I think that'll probably help you a lot. But I'm noticing, I'm just curious, for those of you who have done simulation for, maybe a year or less, can you go down into the participant box and just click yes? We can have an idea about how many people on the call are really, really new to this. If you have done simulation for a year or less, can you go to the participation box and click yes? Because we didn't set this up for a poll, and I'm just coming up with this plan. Okay. We have a couple of people. So there are some people in the state that are really looking at screen-based, Paula, screen-based simulation. Have you been doing, is a year or less, screen-based simulation, a year or less? Okay. Because I'm thinking, thank you very much, you guys, for those who have done it. Yeah, okay. It sounds like when we're talking about trying to help everybody skill up to get ready to support their students in the fall and potentially even winter term next year, there needs to be a lot of, it would be really helpful if we were to try to do some even very, very beginner level stuff. Cynthia Manning said, I've been working behind the scenes helping set up supplies and equipment. I'm moving to a more active position this term and not an RN. I don't think that you have to be an RN to do simulation. I've actually known a lot of people that do simulation that do not have their registered nurse and licensure, and they do pretty well for themselves. Okay, so we've talked about pre-briefing, we've talked about workload, we've talked about resources. It sounds like we're going to try to put together a curated list of resources. Is there any other topic that you guys have a question about? Okay. Julie just put in the chat, our student NAs will be on campus for the clinical experience, and she's working on this now. I'm just curious, do you guys all have your plans ready for simulation for fall term or for your group? Michelle does. Julie in Linfield does. No, she does. Anyone else? Oh, Carol Nice needs some help. We're going to help Carol, you guys. Anyone else? Okay. Okay, Gwen Collins is ready. Jodi is ready, just use also year round. Lynn Chase from Clackamas Nursing Assistant says that she's never done SIM. Not having classes to the pandemic, I think they'll be doing things different for a long time. If they want to get back into classes, that she needs to learn that skill. Someone suggested cheesy study groups. That's certification for healthcare simulation education. Yeah, we're going to be putting those together actually. Linda Campbell said that she's very close to having her plan together for the fall. Sandra said that she just took that test. Sandra, did you pass? Did you pass the CC exam? Yes, great. Congratulations, that is a hard test. Okay. Other questions that you guys want to talk about or anything else that you want to be talking about? Julie Fitzwater over at Linfield said, we are ready to be flexible and adaptable despite our planning. Well said. Well said. I am certain that you guys are also experiencing that wonderful feeling of I've got this under control, and then the situation changes. Paula Tomzak has her hand up again. I'm going to unmute your line. Paula? Go ahead, Paula.
Yeah, I was just, do people have a suggestion of what the maximum number of students should be in a group?
Michelle, I'm going to unmute your line for that one because I can tell you've got an idea. Go ahead, Michelle.
Yeah, I think, I think it depends on the actual design, but I've been to workshops where I've heard people present on very large group simulations. So you know, the objectives, of course, of the sim were different than maybe a smaller group. You know that they lean heavily into the observer role, of course, because not everyone can be an active participant. So it really does depend on what you're going for. We have found in our program, groups of 6 to 8 seems to be most ideal, especially for an unfolding case, but certainly you could go bigger. You just have to be really clear about the objectives and how they tie into your course outcomes, and explain the roles to everyone really well. Yeah.
Excellent. So yeah, Julie Butcher says that she's planning on 3 to 4. Jodi Bennett says she does 4 to 6. Nick Neal says face-to-face, they're limited on space, so virtual online simulations, research suggests less than 10. Julie also says our on-campus clinical experience will have no more than 10 to 1 instructor. Okay. Cynthia Manning had a question. She said, anyone with resources about mixed degree faculty collaboration in sim creation? I'm not really sure what you mean by that. Cynthia, can I unmute your line and you can ask that question and clarify? Go for it.
Hi. So I'm not a clinical person, but I've worked in healthcare, and I've worked here in the lab for several years. I worked in healthcare for ages and ages, and I've got a behavioral science graduate degree. So I'll be working with the clinical faculty who are wonderful, but I'm just wondering if there are other models of non-clinical faculty working with clinical faculty to create, like, what are the best practices in creating a real vital sim program?
Nick, do you mind if I unmute your line for that one?
Yeah, I think that's a great question. I think my best suggestion is having, you know, the expertise that's needed really involved with the conversation. You know, having a simulation expert to look over the best practices and the equipment side and things like that, and then having someone who's a content expert to help write the case. So I think it's you know, as long as we have the right people to the working on the case, I think that's where it's most powerful. Like for me, you know, I can write a case. I'm not a clinical expert. I'd say, you know, OB. So I would want my OB expert there to make sure that we're approaching it from, you know, the best possible way to make sure we're creating great objectives for our students. That we have you know, a really great simulation template for the case. So I think, you know, having the right people there is absolutely important, and having a good mix of people, because we want diverse opinions and viewpoints to create these simulations.
Great, thank you.
Hey,
Is that helpful?
Yeah, that is helpful. Thank you.
Great, thank you. Okay, so we are just about at time. We've got about 7 more minutes. So I kind of want to wrap up and kind of check in with everybody here and let you know what's kind of coming up next and get a sense of what would be helpful. So before we move on, actually, I'm going to go ahead and move on. I want to kind of give you an idea about what you can expect now after we've had this. This really was Q&A, so we could figure out what the questions were and kind of get an idea about where you all are, so we can start figuring out the direction you can go. So first thing that you can expect is that we're going to have an FAQ. We're calling it an FAQ. It's only frequently asked because this one time we asked it, but it's going to be an FAQ about today's discussion, just a summary of some of the things that we've learned. We'll be able to include some of the resources that people suggested, some of the websites that are suggested. But I'm also interested, one of the other things we talked about, we want to do another webinar on September 2nd. A lot of people are out this week. A lot of people are just, you know, in the middle of trying to get their programs together. And so there were a lot of people who couldn't make it today. So if we're going to be having a webinar, we're going to do a follow-up webinar on September 2nd. Is there a specific topic that you would like us to address? Would you like us to address specifically just debriefing in that time? Or would you like it to be kind of an open-ended discussion like today, so you have an opportunity to just ask your questions? Anyone want to put something in the chat box? Not any particular preference? Because I didn't hear like one thing that everybody is really struggling with other than trying to swim through the enormous amount of resources. Okay. Sandra Davis said, focus on types of debriefing. Jodi says roundtable of challenges. Julie said writing scenarios. Okay. And then Paula said, once the FAQs go up, people have a better idea. That's actually true. Okay. So, and then there was another question. Would any of the NA program directors and instructors like to have their own meeting? Something specific for NA instructors. And Carol says she'll have a better idea when she does some more research. Julie would love this. Okay. And we might have something that's specific for the NA program since it's going to be slightly different. But again, the theory still applies. And I think that a lot of the nursing instructors here have some of the same information and can really help provide some research and resources for you. Okay, sounds good. So we'll look into creating something that's NA specific, and then, but look also for the follow-up webinar on September 2nd. We're going to be doing another webinar where we can talk about scenarios or try to narrow down if there's a specific topic we can talk about on that. And then the third thing I want to let you know about is that the Oregon Center for Nursing is going to be hosting and putting on some faculty simulation training workshops. We received a grant from Work Systems Inc., and they're a workforce investment board here in Portland. And what we are going to be doing is some simulation intensive curriculum using the curriculum from the California Simulation Alliance. So if any of you are in programs, this is probably more for the registered nurses than the NA, but we can also, we'll find some resources this will be for the RN, but we'll get resources for the NA too. We can have this will be a simulation intensive workshop that will happen probably the end of September, first part of October. We are going to be having 3 of those over the course of the next year, and I've just written a grant to try to expand that exponentially. So everybody put in all of your good energy into the universe or whatever it needs so we get this grant, because I think that we can expand the faculty simulation training workshops and get some more resources and some curated resources for, you know, all programs in all different areas, and including NAs, because it sounds like you guys need some support too. Anything else? I love this. I love what's going on the chat right now, where people are really connecting with each other, because that is absolutely what we need to do as a nursing community in general. If we really want to make sure that we are supporting our state through this pandemic, nurses can do it. We just need to be communicating with each other and talking to each other. So I really appreciate all of this connection, and I appreciate you all being here. Please feel free to reach out to myself or to us. If you have anything that comes up, if you're in the shower later today and you think of something that you really have a question about, or you want more of this, please let me know. We will be having our Oregon Center for Nursing, our Friday huddle is going to be coming up tomorrow at 8 a.m. and it's every Friday. So if you can't make tomorrow, don't worry about it. We're having it every Friday. And if there's any specific topic or anything that you need that's related to nursing so we can all get through this pandemic, let us know, because we're here to help you, and we're really looking forward to continuing to help you, help the entire state make it through this really uncanny and absurd time. So with that, thank you so much.